Hi, my name is Julianne Kelly, and I am an undergraduate physiology and neurobiology student in Robert Astor's Behavioral Neuroscience Research Lab at the University of Connecticut. Our lab is studying the use of transcranial magnetic stimulation to reduce cannabis cravings in undergraduates with cannabis use disorder. Cannabis use is globally prevalent among college undergraduates, with 25% of students meeting the criteria for a clinical diagnosis of cannabis use disorder, or CUD. According to the DSM-5, CUD is characterized by a pattern of cannabis use that leads to clinically significant impairment or distress. With the legalization of cannabis spreading across the U.S., it is imperative that informed research be conducted regarding the treatment of CUDs in young adults. CUD is associated with adverse consequences such as impaired cognition, poor academic performance, lower income, and lower IQ. Additionally, the misuse of cannabis is correlated with increased anxiety and depression. Transcranial magnetic stimulation, or TMS, is a non-invasive method of neuromodulation that, when used to stimulate the dorsolateral prefrontal cortex, or DLPFC, has been shown to reduce nicotine cravings in a study conducted by ours lab. According to the dual processing theory of addiction explored by Solom and colleagues, there is an imbalance between executive control mediated by the DLPFC and reward processes mediated by the limbic system. Excitatory repetitive TMS to the DLPFC has been shown to enhance top-down modulation of the reward network and reduce substance cravings. The purpose of the current study is to investigate the effects of TMS to DLPFC on cannabis cravings and use in college undergraduates who are at risk for CUD. In our novel study, 60 undergraduates who are 18 or older and have a cannabis use disorder will be recruited from the University of Connecticut. Participants will be instructed to complete several questionnaires to quantify cannabis use frequency and severity, cannabis cravings, depression levels, and desire to change. Our study is a within-subject design in which participants complete two 90-minute sessions 1 week apart, and an online follow-up survey 1 week after the second session. They are instructed to abstain from cannabis use for 8 hours prior to each session. The participant receives sham TMS in one session and active TMS in the other. Prior to the first session, participants complete the questionnaires regarding cannabis use and depression previously described. Subjects are then presented with validated cannabis stimuli, and their cannabis cravings are measured using the Marijuana Craving Questionnaire, or MCQ. The participant then receives either active or sham TMS while presented with cannabis stimuli. After stimulation, the participant is presented with one last set of cannabis stimuli, and their marijuana cravings are measured again. In the online follow-up procedure, participants are asked to complete the QDIT-R, DFA-Q-CU, MCQ, and BDI. TMS is applied by using a MagVenture Mag Pro TMS device with a combined active and sham dynamically cooled butterfly double coil. In our study, we are using a Cool B65 butterfly coil. The Localite TMS Navigator system is used to localize the left primary motor cortex and left DLPFC in each participant using anatomical markers. The participant's motor hotspot, in which a maximal motor response is generated in the index finger, is located and used to determine the resting motor threshold. In our active TMS parameters, an intermittent theta burst stimulation, or ITBS, protocol is used in which 600 pulses are delivered over 90 seconds at 100% of resting motor threshold. 3 pulses are delivered at 50 Hz with a 200 millisecond gap repeated at 5 Hz for 2 seconds with an 8-second break. Pulses are initially delivered at 80% of resting motor threshold and will ramp up by 5% for each train until 100% of resting motor threshold is reached. The sham stimulation will appear to be exactly the same as the active stimulation, except the device will not emit any magnetic pulses. However, the device will still make the same clicking noises that result from the device stimulation. Our preliminary results for a total of 10 subjects indicate that cannabis cravings are significantly reduced after active but not sham TMS. The average MCQ scores showed little change pre versus post sham stimulation, while the average MCQ score decreased by 13.8 post-active TMS. Due to limited sample size, statistical analyses could not be conducted. Follow-up data will help quantify how long this reduction lasts and how strongly it generalizes to real-life reductions in cannabis use. Our novel use of TMS to reduce cannabis cravings in college undergraduates does not explore the potential neurobiological mechanisms that contribute to this effect. In the future, fMRI may be used to examine the effects of repetitive TMS on dopaminergic signaling in the DLPFC to provide a possible explanation for how TMS works to reduce cannabis cravings. With a greater sample size and more data, we hope to examine several other relationships, including correlations between cannabis use patterns and depression scores, the effects of TMS on cravings and use of other drugs, and how desire to change is correlated with cannabis cravings and use after active stimulation. I would like to thank the Connecticut Institute for Brain and Cognitive Sciences and the Office of Undergraduate Research for providing support for this project and conference. I would also like to personally thank my principal investigator, Robert Astor, and graduate student Skylar Sklenerick for mentoring me throughout this process.